I am taking these concerns seriously, and I've spent a lot of time listening to clinicians, listening to physician associates as well, by the way. I think they do have a role to play and can add value, not least in freeing up doctors' time to do the things that only doctors can do. But I think there are legitimate concerns about the extent of doctor substitution and replacing doctors with PAs. There are issues around transparency. As patients, we should know who we're seeing, who's in front of us and why. And we've got to take those issues seriously.
In November, the government confirmed it was launching an independent review of physician and anaesthesia associate professions. In a statement, Health and Social Care Secretary Wes Streeting said, "There are legitimate concerns over transparency for patients, scope of practice and the substituting of doctors. These concerns have been ignored for too long, leading to a toxic debate where physicians feel ignored and PAs feel demoralised." Healthcare professionals have pointed out that loading your front line with a huge amount of inexperienced, less qualified people has real safety implications. That's why safety-critical industries don't do it. It's why, for instance, we don't have associate airline pilots.
When you last went to the doctors, are you sure you saw a GP? If you'd in fact seen a physician associate, would you know how they differ from a doctor?
Unlike doctors who study for up to 7 years, physician associates only require 2 years of study.
The British Medical Association has called on the government to stop what it calls the dangerous substitution of doctors and to act urgently on the issue of medical associate professions who are being employed across the NHS without any defined national scope of practice, posing what the BMA says is a real and present risk to patients. More than 13,000 doctors have added their names to a BMA letter warning of the profession's grave concern over the current use of medical associate professions in the NHS.
I think there is confusion about what these staff are doing, because not only are they being labelled as physicians or specialists, but they're clearly undertaking tasks that are inappropriate for their level of training. And that goes to the very heart of the matter, in that no one has defined what these staff can and cannot do. We asked 18,000 doctors what their experience of these medical professionals were, and 87% of them said that they were witnessing practice that was putting patients at risk.
The BMA has announced legal action against the doctors' regulator, the General Medical Council, over the way in which it plans to regulate physician associates. Plans which the union says will mean a dangerous blurring of lines for patients between highly skilled and experienced doctors and assistant roles.
There clearly are concerns, aren't there, with how these PAs are being used.
Alongside the BMA, Anaesthetists United, an independent group of grassroots anaesthetists, have begun separate but complementary legal action which relates to the lack of national regulation of scope of practice for physician associates and anaesthesia associates, a vital issue which the GMC has studiously avoided. Here's Richard Marks from Anaesthetists United.
So no national restrictions on what associates can or can't do, no standard guidance on supervision, and no agreed process for patients to give consent. Whose idea was that? Did the GMC come up with it themselves, or was it the government's idea? Where exactly is the GMC getting the money from to pay their lawyers to defend their outrageous position?
A good question. Exactly who is paying the GMC's litigation costs in defending these cases? After all, the cases are being brought to protect patient safety. In a written question on 2nd of December, Green Party MP Adrian Ramsey asked the Secretary of State for Health where the legal costs associated with the case between the General Medical Council and Anaesthetists United regarding regulation of physician and anaesthesia associates will be paid for by the Department of Health and Social Care or any other public body. Hang on to your seats for the government's reply. The Health Minister responded on 9th of December. The government is funding the General Medical Council to undertake the work required to introduce regulations for anaesthesia associates and physician associates to avoid doctors paying for this through their registrant fees. A long-standing principle underpinning the introduction of statutory regulation for new professions is that all related costs, including legal challenges to that work, should be funded by the government to avoid other professions cross-subsidising the work involved. The DHSC has confirmed it's paying the GMC's litigation costs with taxpayers' money. Just think about that. The Health Secretary is actually using taxpayers' money to defend a case brought to protect patient safety. Now, there's nothing wrong in the government funding the GMC to undertake the work required to introduce regulations for anaesthesia and physician associates. But if, as the Health Secretary says,
I think there are legitimate concerns about the extent of doctor substitution and replacing doctors with PAs. There are issues around transparency. As patients, we should know who we're seeing, who's in front of us and why.
How on earth can he justify using taxpayers' money to defend a legal action calling for nationally agreed guidance on what physician associates and anaesthesia associates can and cannot do? Surely national rules about what physician associates can and can't do, standard guidance on supervision, and an agreed process for patients to give consent should be a given. It goes to the very heart of patient safety. With a £22 billion black hole in the country's finances, which the government says needs to be filled with tax hikes and cuts, I'm sure UK news shows can't wait to ask the Health Secretary if he believes this is an appropriate use of taxpayers' money.